By now, you've probably heard that AI has come to dentistry. So in this video, I'm going to talk about artificial intelligence and why it matters in dentistry. While this is something we all knew was coming, it still feels a bit scary to have artificial intelligence in any type of healthcare. When it comes to healthcare, the thing people value most is a caring provider. So with 15 years of experience in dentistry, I was a bit skeptical about using AI at all. However, once I was introduced to it, I was pleasantly surprised. It's really being used only as a tool to help explain things better to our patients and show them things more visually, which has always been a bit of an obstacle, trying to explain treatment to patients in a way that makes sense with a gray and more gray x-ray. With AI, it's become quite a bit easier. There are a few types of AI software now that you can choose from, and they are all fairly similar, but I'm gonna focus on one today called Vidya, because it's the one that I know the best, but you can use any of them. It wasn't just created with software and AI, it was actually created by multiple dentists with decades of experience diagnosing and annotating x-rays and caries and perio over years and years. These were highly trained dentists that put their own knowledge and experience into this AI so that it could work as closely to what any dentist would diagnose themselves. This is not a way to diagnose and treatment plan, it's simply a way to better show your patients what you are seeing. It gives the provider full diagnosing autonomy. The provider is always the final decision. So how this AI works in dentistry. With x-rays, the AI algorithms quickly analyze the x-rays, detecting bone loss, caries, and calculus. There's a higher level of grayscale that sees caries at a higher level than the human eye, which can lead to more accurate diagnosis when it comes to evaluating these radiographs. This technology is helping dentists to make more precise diagnosis, which leads to early detection and timely interventions, improving patient outcomes quite a bit. Because any dental professional knows the earlier you find something, when it's smaller, the better. With the patient view setting, the caries are highlighted in bright red, so they are much easier for patients to see, much easier for providers to point out, and the bright red gives a sense of urgency rather than just, do you see that tiny area that is slightly darker gray than the other gray areas? You know what I mean? There's also a compare visits button that shows the disease progression side by side in the x-rays. The AI automatically transfers all the past patient x-rays up to 18 months, as well as present as soon as you download the software onto your system. And the detections have been cleared by the FDA to be used as a medical device. So here are the limitations. Image quality does play a role. So if the contacts are crossed or if it's a bad radiograph altogether, it may miss things. Again, it does not take the role of the provider, it's only here as a tool. As far as perio goes with the radiographs, AI can pick up bone loss and automatically measures it for you. It measures from the CEJ to the level of the bone, and the bite wings are measured in millimeters, and PAs are a percentage. There's a color system of green, orange, yellow, and red. You can set it to default settings, or you can create your own settings to coincide with the color system. For example, the default is green is 1 to 3 millimeters, yellow is 3 to 4 millimeters, orange is 4 to 5 millimeters, and red is 6+ millimeters of bone loss. So when you click on your patient's chart, the AI will tell you if you have perio planned, such as SRP, and also if it has been completed. The AI also picks up radiographic calculus and highlights it for you so you can easily show the patient. This can create consistency between providers and align the team, and it can also make compliance with patients a lot easier. It is highly recommended that the default settings are discussed amongst the hygienists and doctors and you all agree on the same setting so that the team is consistent. These visual cues help patients to connect the dots and see why they need gum therapy and why they have perio disease. Okay, so treatment planning. AI considers patient history, preferences, and clinical data to tailor treatment recommendations. Imagine having an intelligent assistant that suggests the most effective course of action for each patient according to a whole bunch of different factors and information. Transparency matters. A lot of times you will recommend treatment to a patient and they will give you this kind of like prove it attitude. Now you can show them on the x-ray with AI where their cavity is in red. Rather than just showing a different hue of gray, it will actually show cavities in a completely different color, like red or bright pink, which is a lot more visually easy for patients to understand and fosters compliance. It works the same way with the periodontal diagnosis. You can show the patients a measurement on the x-rays with the AI. Rather than having to explain it all out, you can literally just show the patient that there is a 5 millimeter pocket of bone loss with the AI measuring tool on their radiographs. It also fosters more production. Patients are going to be able to visibly see things like cavities getting bigger and bone loss getting worse. So rather than just having to believe you, they will actually be able to see it with their own eyes and they will want to get it done. Okay, so helpful tools. There is a case presentation tool that highlights all the caries in red, fractures in blue, and shows where there is 25% to 50% of tooth structure missing or compromised. The AI picks up all of the findings, tells you how many there are, and then shows if things are unplanned, planned, or completed. You can confirm, reject, or monitor any of the AI findings if you wish, but you don't have to. There is a morning huddle tool that shows outstanding treatment for each patient, which can easily show you where there are treatment opportunities to add to the day. Okay, and then insurance. Insurance claims automatically go with the x-rays, description, and measurements to help with claim acceptance. You can even screenshot sections where the caries or bone loss are or radiographic calculus is on the x-ray and click submit with claim. The claim summaries pull from the most recent x-rays automatically. Okay, so the big thing is revenue impact and marketing potential. AI can be a unique way to attract patients into your dental practice. By marketing that you are maybe the only practice in the region that has implemented AI, this can be a powerful marketing tool, especially to a younger demographic who could become a lifelong patient. And when it comes to patient referrals, satisfied patients who experience efficient AI-enhanced care are more likely to refer others to the practice, which creates a positive return on investment for this AI software. Because while initial implementation may require an investment of purchasing the software and time to learn it, the long-term benefits outweigh the costs. Improved patient outcomes, streamlined processes, and reduced errors contribute to this ROI, as well as increased treatment acceptance. Because being able to visually see decay and bone loss on radiographs with the help of AI will increase patient acceptance of restorative and periodontal treatment recommendations, and therefore build more revenue into your practice. Also, you're not adding time to appointments by using this. You are already in the patient's x-rays. It's just a different view. And once you get the hang of it, it actually makes things move much faster and more efficiently. So in conclusion, the future of dentistry as we step into 2024, AI is revolutionizing dentistry, enhancing diagnostics, treatment planning, and patient outcomes. Dentists who embrace AI cautiously while understanding its benefits and limitations and leveraging it alongside their own expertise will elevate patient care, enhance efficiency, and position their clinics for growth. Remember, while AI can analyze data efficiently and help with transparency and trust, the human touch remains irreplaceable in compassionate patient care. Thanks for tuning in, and if you want to apply to work with us to help you with your marketing your dental practice, you can click the link in the description below or visit mintyfreshmedia.org.